Hello, my name is Frank Samstad, and the aim of the presentation is to present data from a new study using MPPT for treating wounds and pressure ulcers in persons with spinal cord injury. The study is a collaboration between the National Spinal Injury Center at Stoke Mandeville Hospital, the Duke of Cornwall Spinal Treatment Center at Salisbury District Hospital, the Spinal Injuries Association, which is a patient organization, and Willingsford, which is the company that has developed and is manufacturing MPPT. MPPT is an abbreviation for micropore particle technology. It's a passive immunotherapy that acts by supporting the immune system. It has no antimicrobial action. A 266 patient RCT showed that MPPT removes wound infections 60% quicker than antibiotics and antiseptics. It is classified as a medical device and has been approved since 2016. It's available as a capsule, approved as a treatment for wounds, covering all types of wounds and patient categories, as well as Amicapsule SCI, which is approved as a treatment for wounds in immunosuppressed patients, for example, persons with spinal cord injury. Towards the left, you can see the packaging format and comes in bottles, and towards the right down here is MPPT itself, which is a white powder that's applied topically to the wound surface. MPPT is very easy to use. All you do is you debride the wound and wash it very thoroughly with tap water, dry it gently, apply Amicapsule evenly in a layer of 1 to 2 millimeters to all wound surfaces. Then you dress the wound with a dressing that allows air to access the wound surface, or you can omit a dressing altogether. The study itself was a prospective single-arm study in accordance with followed guidance by EMA and the ICH. The entry criteria were a wound or pressure ulcer below the site of injury in a person with spinal cord injury. All wounds that presented during the enrollment period were included. There was no selection. The only exclusion criteria was really non-compliance. The treatment itself was delivered as a tele-treatment where the patient, family, or care was responsible for the daily washing of the wound and applying the capsule. They took pictures of the wound, sent those to a wound evaluator who studied the pictures and provided feedback of what to do the following day. First example here is a grade 4 pressure ulcer, which was detected on December 1st. At that point, it was a grade 3 ulcer. It received daily treatment with Urgotul dressings, and then after January 16th, also with Flamanal. After 52 days with standard care, it was decided to move on to Amicapsule. At this point, it was a rather deep, quite infected grade 4 ulcer, as you can see here in the picture. After 87 days, on April 19th, full closure had been achieved. The person here was a tetraplegic, and the location of the wound was on the ischial tuberosity. Another example, which is also a pressure ulcer on the ischial tuberosity in a tetraplegic person, was a wound that had been treated for 9 weeks with Manuka honey and had been highly exuding. You can see here, this is the status on day 0 when treatment with Amicapsule is started. And you can follow the progression with the use of Amicapsule and where it reaches full closure. Now, Rennet et al. In 2009 reported about 32% of grade 4 ulcers, pressure ulcers develop osteomyelitis. The wound itself does not have to be huge, but the infection has to reach the bone where a bone infection then can develop. Once the infection is more than 6 weeks old, it can only be removed by surgery. As the infection becomes more severe, it releases corrosive infectious debris into the surrounding tissue, which causes the creation of a large uncontrolled wound with considerable soft tissue infection. The way Amicapsule can help is to reduce, it addresses the infection itself, so it reduces the soft tissue infection. This allows regeneration of tissue, and it can end up with having a very narrow draining canal, which provides a route for the infected debris to escape from the bone to the skin surface where it can be removed. In 2020, Russell et al. Published a study on the outcome of surgery for osteomyelitis in the pelvis, where the osteomyelitis had been caused by a pressure ulcer. It was a retrospective study at a UK hospital. They found that the age of the pressure ulcer causing the osteomyelitis generally had a median age of 4 months, ranging from 7 weeks to 12 months, so actually quite young. 71% of the patients experienced failure of surgery, defined as requiring new surgery or receiving IV antibiotics after the surgery. They found that the failure rate correlated with high infection markers, CRP counts. 64% of the patient's wounds failed to heal post-surgery. That was even despite repeated surgery. They saw that these correlated with the lack of tissue covering the bone following surgery. That means primary closure was not possible. They also found that the median time to death in this group was only 2 years, ranging from about half a year to 3.5 years, which is not very much. And finally, that long-term antibiotics did not improve the outcome. And the question is now, of course, how can is any way amicaprol can help to increase the success rate of the surgery? One is to restore tissue to allow primary closure, and second is to reduce the infection levels. Example of tissue regeneration is this grade 4 pressure ulcer, which at this point here is 1 year old. The opening is 5.5 by 3 centimeters. It's quite deep, and you can see all these tissue flap or gorges in the bottom of the wound. After 1 month with amicaprol, the size of the wound has reduced by 50%, and it's looking much more healthy. After 4 months, reduced to a narrow draining canal with an outer diameter of 1 by 1.5 centimeter. Just to give an idea about the extent of the osteomyelitis, you can see here on March 22nd, the bone fragment actually fell out of the wound, so it has been quite advanced. An example of reducing the infection levels is this grade 4 ulcer, also with confirmed osteomyelitis. It's a cavity wound using an endoscope to look into the wound, and here you can see the bed of the wound inside. You can look at the coloring of the tissue. It's brownish, clearly unhealthy, filled with infection. At the bottom, you can see the outer opening. Then after 10 months with amicaprol, you can see very nice, healthy tissue. The size of it has reduced very considerably. You can see the draining canal going down to the bone here. And you can see that also the outer opening has reduced considerably here at the bottom. When the person started on amicaprol, he was on full bed rest, but he was able after quite quickly to stop the bed rest, and now he's active 8 to 11 hours daily exercising and has a quite normal life. The family manages the wounds themselves without any help, so they are essentially independent. Another example of this highly exuding grade 4 pressure ulcer, where you can see it's also a wound with confirmed osteomyelitis. On day 0, before the start of MPPT, in order to control or to absorb the wound exudate, it was necessary to use a very highly absorbent dressing together with 60 centimeters of packing in order to absorb the exudate. Even that is not enough. After 2 days with MPPT, it has reduced quite considerably the level of exudate. On day 4, it's even less, and already on day 6, it's possible to control the exudate just by simple cotton gauze dressing. And on day 12, the patient decides to drop the dressing altogether and just use a pair of cotton pants to absorb the exudate because it's now so small. The white material you can see on the pants here are dried MPPT. The study itself included a total of 43 wounds. There were 21 acute wounds, so less than 6 weeks old, grade 1 to 4. 12 chronic wounds, grade 3 to 4. All of those closed. There were 10 wounds with grade 4 with underlying osteomyelitis, and in all cases, the wound reduced to a narrow draining canal. No adverse events were seen in the study. It was used daily for up to 20 months directly onto muscle and bone without any problems. No allergic reactions or wound irritation. Has the advantage that bed rest is not required, and its effects are not limited by antimicrobial resistance. Finally, in terms of costs, Guest et al. Published a study in 2018 where they studied a very large number of patient records from community care in the UK, and they looked at, among others, specifically on acute grade 3 pressure ulcers. They found that they looked at it from start reporting the wound to the health professional, and then for the following 12 months. They found that with standard care, the closure rate was only 17.6%. Days to closure was an average of 234 days, and cost of treatment for these first 12 months for the grade 3 ulcers were £7,829. For MPPT, in comparison, the closure rate was 100%, days to closure only 31 days, which makes a huge difference in terms of a patient's life and ability to rehabilitate afterwards. And the cost, including care, were only £1,265, so providing a savings of 84%. So what you've seen is MPPT is able to close the wounds and also provides very large cost savings to the healthcare system. In terms of the telemedicine approach, the approach allowed the patient independent time planning. They did not have to wait for the nurse to come around to change the dressing. It meant it was easier for them to stay socially connected, maintain a job, go on vacation, etc. Also has the advantage that it provides equal access to treatment independently of location, because the way it's done is basically just a package with the capsule sent to the patient, and from there on everything takes place over email. Also, once the person is familiar with the use of capsule, they require much less support, and particularly for a group of persons with spinal cord injury, it is huge benefit because they often tend to get quite a number of pressure ulcers. It allows to free up the time of healthcare staff for other duties, and the whole approach has been extremely well received by persons who participated in the study. In terms of the environment and climate change, capsule only contains fully biologically recyclable components, so nothing that's toxic, nothing that cannot be absorbed directly back into nature. There's no antimicrobials, so it will not contribute to antimicrobial resistance and will have no environmental impact. No plastics or chemicals are used in the process. All the packaging are fully recyclable, and due to less transport, because the nurses do not have to visit the patients, there will also be reduced CO2 emission. So I think that's it today. Thank you very much.